Hello! We are excited to be with you today, sharing the work of our leadership team, who has been developing strategies and best practices for resuming care during the COVID-19 era.
The purpose of our video today is to describe how we're resuming care while simultaneously reducing the risk of viral transmission amongst patients, staff, and our community. We are actively testing our systems now with plans to ramp up both diagnostic procedures and treatment cycles in the coming weeks. Please watch our website or send portal messages to stay updated on our progress. Things will not be business as usual when you return. That's at least until we have a vaccine. But we've found ways to move forward now using lessons learned both here and abroad.
So what should you expect? We will be continuing to maintain a physical distance between persons, so that's greater than 6 feet. We can do this by using telehealth for any visit that does not require an examination. And when coming into the office, we'll be limiting the number and duration of appointments. So in-office appointments for ultrasounds, for blood tests, for HSG, you'll see fewer patients. Also, patients will come alone. Their partners are more than welcome to be connected to us via the phone. You'll have fewer chairs in the waiting room, and care will be completed in our examination rooms. This will facilitate optimization of disinfection between patients. We will, after we complete our ultrasound, have a chance to discuss, but these will be shorter in-person discussions. And if longer discussions are needed, we can schedule an additional telehealth visit for longer discussions.
Our protocols are specifically designed to be cognizant that asymptomatic patients can and do shed virus. 25% of people that are shedding virus have no symptoms at all. When you come into the clinic, you're going to see our staff wearing masks, our patients wearing facial coverings, and us implementing COVID testing before we resume cycle starts or do procedures that require sedation. The COVID testing that we're doing currently involves a nasopharyngeal swab, and we've done it, so we know that it's not that uncomfortable. We're actively watching for the development of blood immunotesting, but it's not accurate enough yet to use in our clinic.
Our protocols are also designed to minimize any disruption in care should one of our staff members contract the virus. You will notice that our employees, our staff, will be rotating through the office Monday, Wednesday, Friday, Tuesday, Thursday, weekend. These rotations will allow us to keep a greater physical distance between employees. Also, all patients and staff will be completing screening questions and temperature checks before entering the office. Screening questions are to determine the chance that someone has been exposed to the virus. So we are asking about cough, fever, muscle aches, contact with a patient who knows they have COVID or is a person under investigation, and any travel to one of the areas considered to be a COVID-19 hotspot.
Finally, our protocols are designed to minimize the impact on local health systems. We're very fortunate that the spread of the virus in North Carolina has been significantly lower than some other areas in the United States. Our local hospitals seem to have enough personal protective equipment, and we're not expecting any bed shortages in North Carolina.
We are also using a type of personal protective equipment extender called a Montana mask. So what you see here is Jessie in a standard surgical mask, and you see me in a Montana mask. This enables us to divide the filter of a standard surgical mask into 4. Each of those filters then can be placed into this reusable 3D printed and therefore cleanable mask extender. Now, if you're looking for information on the designing facial covers, the CDC website has some very helpful information on how to fold a scarf or a bandana or a t-shirt to place across your face, connecting with either rubber band or hair loops to the ears. If you have sewing skills, they also have patterns for sewn masks. Now, none of our fertility procedures in the office require ventilators. That has been true before COVID-19. When we need a ventilator, those procedures are done at local ambulatory surgery centers. So while procedures in the office will be rolling out in the near future, procedures at the local surgery centers will be predicated on when they resume care.
Before resuming care, we're going to ask you to do 3 things. Number 1, sign a resumption of care consent, and this can be done online using EngagedMD. And if you have any difficulty, our nursing staff can help you do that. We're going to ask you to actively work on acquiring a facial covering, something similar to what Dr. Copland described, so that you can wear that in our office. And finally, just simply, we want you to agree to comply with the measures we're putting into place that are designed to protect you, our staff, and our community.
Each of you will need to decide if you are ready to resume care. There is still uncertainty about the risks of this virus while trying to conceive. A vaccine is projected to be 12 to 18 months away. If you do decide to resume care, we are going to ask that you continue to follow physical distancing guidances, continue to keep a facial cover, watch the CDC website, watch the American College of OBGYN website, so that you can keep up to date on measures designed to help women who are currently pregnant protect themselves from COVID-19.
We're excited to see you again. It's our path to building families together.